There. We are live now.
Yeah.
Hey, now we're live. Let's go. All right. Welcome, everybody. This is our first UroFill live of the year. My name is Dr. Alfredo Suarez-Sarmiento Jr., and I'll be your moderator today for the discussion. We have a really exciting day. We have a conversation lined up with two of our incredible experts in the field, Dr. Paul Perito, the inventor of the UroFill technique from Perito Urology, and Dr. Clay Williams of Elite Enhancement of East Texas, Tyler, Dallas area. Thank you, Dr. Williams, Dr. Perito, for being with us here today. But just to give a little, before I let these guys talk, just to give a little introduction, Dr. Perito was the founder of Perito Urology and a pioneer in this space when it comes to cosmetics and implants. And Dr. Williams, the same thing. He's been our provider now for about 2 or 3 years, but he's got plenty of experience, 10, 15 years in urology. But today, it's not about the science. We're diving into real patient success stories with the UroFill technique. For those of you who may be new here, UroFill is the first and only patented penile girth enhancement technique using hyaluronic acid. It's safe, it's minimally invasive, and it's performed exclusively by urologists who are certified by us at UroFill. So we've been trained to deliver this. We have over now 11 years of data and going. But beyond the technical side, what makes UroFill truly special is the impact that it's having on men's confidence, their relationships, overall well-being, and well-being, sharing some amazing patient journeys and how they got here, because every patient is different. Urofill's not one size fits all. It's for every man. The man that has a little bit wants a little bit more, the guy that maybe has something that was bothering him aesthetically. So today we're here to answer it all, so make sure to drop your questions in the chat and I'll try to get as many as possible. But let's get started with Dr. Perito and Dr. Williams. Thank you guys again for being here to kick things off for our first Urofil Live of the year. Florida and Texas, it's a nice cross country thing. But I wanted to start with some icebreakers. Dr. Perito, what inspired you to get into male cosmetics, especially general cosmetics?
Well, after 20, maybe 25, 24 years of doing penile implants, you learn one thing, that men focus specifically on length and girth. You give them back their function, and you would think that they're happy, but they're unhappy because if you have erectile dysfunction, you're losing length and girth, and it's a realm that was really not entered into by those of us that are experts in the field of the penis itself. So it was probably about 12, 13 years ago, we started experimenting with certain modalities. I tried some of the stuff that was out there in the Ethernet, and nothing was favorable. But then we moved into the use of hyaluronic acid. Then we just applied everything I've learned from doing penile implants to doing penile girth enhancement with hyaluronic acid, and it's transformative for my practice, for my patients, for my implant patients, for a whole new realm of patients, which we'll go over in a little bit, because this is something that has been completely neglected by our societies, our colleagues, and our colleagues and our societies now. They're all on board, totally on board, to take care of male genital cosmetics.
And then Dr. Williams, the same question to you. What interested you in this field?
I'll try to keep this short, but that's, it's very interesting. You know, I think, Paul, the first time I came down to do training with your minimally invasive penile prosthesis was 2018, and I've been back countless times. Miami is a good time, but I actually did want to do some, good training down there. And I've always told you, easy cases and bring on the redos. And I don't know, maybe the fourth or fifth time, I came down there, you took me into the room, and I expected to see a post or pre-op implant, and there's a tray full of needles, and you started doing girth enhancement, and I was like, what the hell? I was like, what are you doing? And you explained it to me, and I don't even know where to begin. I remember came back and told my wife. She's like, what? I was like, I'm not joking. So at some other SMS, we had some cocktails and we were talking about it again. I said, well, I'm still interested, but yeah, I don't know how to do it, because I do urology with the University of Texas with 5 of the guys, and I couldn't figure out how that was going to work. Not being in private practice anymore. My wife said, well, maybe we should start our own business and do what we know to do, the marketing, and you do what you know to do. You're an expert in male reconstructive surgery. So we kind of had to wait till our oldest child, our daughter, was a senior in high school. We weren't quite empty nesters, but as you know, when your kids getting high, senior, you might as well be empty nesters. They're not around anyhow. And she said, you should contact Alfie and Paul, and we should go down there and really, we should start the company and start this. And so, we came down there, trained with y'all, the marketing, the technique, just hours upon hours of training and really getting into it. And it was just mind boggling because on a day-to-day basis, urologists, we do reconstructive surgery, male, female, we do kidney cancer, prostate cancer, kidney stones, and that's all rewarding surgery. Don't get me wrong. The patient's happy, we're happy, but, and it's been a bit beneficial, but at some point, some of that, the rigors of what we do medically and surgically, it takes its toll mentally, physically, spiritually, emotionally. And what excited me about, girth enhancement with UroFill was it was something that was reproducible, safe, efficacious, and at the end of the procedure, everyone's happy. Not that it's not happy to cure someone's prostate cancer, but I mean, let's think about it. This is, 20, 30-minute procedure and give or take. And the guy walks out and he looks out and he's like, dang, I mean, he's got girth right then. And so, no side effects, very little risk, if any. And that's what really sold me was that these guys, like you said, Paul, the day we wake up, in the morning or the day we're born, we look down and that is the only thing we're fixated on is our penis. And so to do something like this for these men that has no risk and is just cosmetically beautiful, functionally, everyone's excited with, no risk. It was just it balanced the life of urology for me, of something very satisfying and gratifying very quickly to both, me and the client. So that's kind of what sold me on it.
Just real quick, where he's going, I'm giving a lecture this weekend to all the top implanters in the world. And, where you're going with that is dealing with pathology we're accustomed to, dealing
Mm-hmm.
with vanity we're not. And when you deal with it appropriately and you have the skill set of a board certified urologist who specializes in reconstruction and andrology, it's a game changer for your patients and for yourself. So
Yeah.
and I'm glad that you and your wife, yeah, and you guys can come back anytime. Miami is a good place to visit.
No,
Oh yeah.
I get you, brother. I get you.
no, and that's great to hear. Really the message about Urofil all along was that we want to be the stewards of the penis. Nowadays, marketing, internet, social media, there's a million different ways where essentially men of this world are being duped or preyed upon for reasons of grandeur or what have you. So, we really want to be on our soapbox here and show what is the best way. And by staging and by all these different techniques. But, Dr. Perito, I like what kind of patients might your field be for? Who might have benefited from this?
So Clay already touched on, the Vanity Project, which if you look at men, you take a million men, right? At least 25% of them would like to see more on their penis, whether it's length or girth, and whether it's resting length or girth. Let me make that resting length. And these are things that can be done, and so that would be your biggest population of patients, which are that 25% of all men across the globe that would want to have just a little bit more. Then you have the subset of men that have some pathology. Maybe they've had a penile implant and their penis is too ovoid and they want to have the more rounded out appearance. Maybe they have Peyronie's, they want to fill in a defect. Maybe they have premature ejaculation. There's all kinds of uses for hyaluronic acid, and because we're board certified urologists, it just opens up an enormous group of patients that need service. And I've known that my implant patients have needed service from the get go, because that was the common complaint. But that complaint it's not a pathology. It's a normal anxiety that men have, and they might have a perfectly normal penis. And how often, Alfie, do people come in? They got a enormous penis, and they still want more. And
Exactly.
they're not dysmorphic. They just, why not? If you can do it, you can do it safely. Why not do it? And why not do it with a reproducible technique?
Now, Dr. Williams, I want to talk a little about maybe real life transformations. I mean, have you ever encountered any cases where UroFill significantly improved the patient's confidence or maybe brought a relationship back together?
Oh man, I could probably bring up countless stories, and I'm sure y'all could too. Um, you know, you know, we keep going around on this. One is just overall confidence. The shower room or the locker room confidence. That you're going to have your pants down or something. Um, I've had a guy before who was at a country club, and he was taking a leak, and his buddy came up next to him to take a leak, and he was just, I guess he kind of glanced aside. He's like, "Oh my God!" And he goes, "What?" He goes, "Dude, I did not know you were packing that hard." He goes, "Yeah, man." But one thing is that obviously it didn't look abnormal. I mean, he had an enlarged penis, but it looked natural, and so he couldn't tell that this guy, his friend, was not born with it. So the confidence level is really cool. The other thing we hear about, Michelle and I, is anatomy. As guys get older, we lose girth and length, and there's atrophy. But due to women having vaginal deliveries, due to the lack of hormones in women, there's an anatomical, there's a physical mismatch between the penis and vagina where they don't match up anymore. And so we have a lot of guys who they admit that, and there are significant others do too, that they don't match up. And so they want the girth so that there's a better contact inside the vagina. We hear that all the time. Emotionally, guys that are, divorced, widowed, they're back on the market. We see a lot of that, and those guys are very happy. And then, you always get the guys as, just normal erectile dysfunction. They lose girth and over the years. And so you work on their erectile dysfunction with medicine, Viagra, Cialis, something, but they need to get back the girth they lost, in their 20s and 30s. Two particular instances, though. We had a very sweet man a couple months ago. He had bladder cancer, and he had to undergo a radical cystoprostectomy, which is removing the bladder and the prostate, everything around it, and you have to get a conduit on the side, and not a colostomy for your feces, but for the urine, put a bag, and the nerves and the blood vessels to the penis are damaged, and he and his wife had been very sexually active, and I've got his erections back going with injection therapy and with Viagra and Cialis too, but he lost girth. And when Michelle and I did girth enhancement on him, the smile on he and his wife's face, they got the erections back. Now he's getting back the girth, and it's heartfelt. And then we have a big Medicare population here, and we get the granddads. The granddads and grandmas. They've given their kids money. They've spoiled their grandkids. Rotten. They have money. They're like, forget it. I want the wrinkles out of my penis. I want a smooth looking penis. And me and my wife here, we may be grandparents, but we want to spice up the love life. And we see that all the time here in Texas. It's hilarious. It's awesome, man.
That, you remember this one, Alfie? There's a funny vignette where a guy's describing he's on his third round, so he's already gotten busy with his partner, and he's describing, because right now we're in the process of putting together the data on how partners respond to this, what you were alluding to before. And if you were to say anecdotally, partners are thrilled, just thrilled. They're not even embarrassed about it. But I remember this one fella saying that after his second or third round, he was like, I was making love to my partner, and she said, "Oh my God." And he goes, "Now I know what it's like to have a big dick." Is that that just cracked me up. That was a classic line.
Oh,
Which,
shit.
I'm sure he was fine before, but he just, he made himself very present that day.
Funny.
No, and these are great stories, and we love having our couples of all ages, but especially the ones that, like you said, the empty nesters, their kids are gone, they finally have access to the whole house, without having to run away startled or what have you. So
Yeah.
those are the ones that we love, and they're the ones that get the most excited. It's the same thing with penile implants. When you see a happy couple or a couple that's been struggling and you finally help them, I mean, that really is sometimes the missing piece to for them to get back their mojo and you know enjoy the rest of their years with their kids off at school.
Yep.
Um, and we are going to talk a little bit about the science of UroFill, but we have a couple questions here. I thought I would, why don't we give this one to Dr. Perito here? So, the question is more or less now, yes, the UroFill technique can help people, get a transformation. But say a person is in their 30s when they get this, is there some sort of risk of complication once they get to their 50s or 60s of having this injected into them?
So I don't know who gave us that question. I can tell you that the largest database with the longest time frame would be ours, and that's going back somewhere around 14 years. The fact of the matter is that the hyaluronic acid that's in the phallus, I have guys from 12 years ago, they come in, it's still in the phallus. There is no potential complication, because hyaluronic acid is a is a chemical compound that's in your body. It's natural. So there won't be any potential complication for. I could give a ton of potential complications for other materials that people are using. But, that question 30, 40, 50 years down the road, I can tell you that my patients from 12, 14 years ago, they're just thrilled that they still have it, and they're not even the least bit concerned about a potential complication, because the potential complications occur when you're using a filler that can cause a hypersensitivity reaction or a granulomatous reaction, and that goes a little bit beyond what we're doing today. But you can get all this information from any of our UroFill websites, any of our providers, because this is something that won't have the potential for that kind of complication. Can you have a psychiatric complication? I can tell you that we have removed hyaluronic acid with an enzyme, simple injection in the office on 2 men out of thousands over the last 14 years. One of the guys, he just went through a transformation where he was just like, I enjoyed having a larger penis. Now I want to have a smaller penis. That was his decision. And we were able to have it immediately, same day, removed. In the office, they go back to work, and there's nothing to worry about. That's a great. I've never heard that question. Have you
Yeah,
ever heard
yeah, no,
that?
no, it was a good one. That's why I had to
Yeah. No,
thank you
that's
to that
awesome.
to that commenter.
That's awesome.
Now, and I guess that kind of leads us to, and I'll give this one to Clay. What do you feel sets your field apart, possibly from other techniques of penile augmentation, cannula, maybe silicone? People speak a lot about permanent fillers and things like that. What makes us the difference?
Yeah, well, where to begin on that? Number one, Paul, you did your due diligence and you got this technique patented. So it's the only patented filler technique. And
Let me remind you, Clay, about this patent, but keep going.
yeah,
Okay,
I
keep going.
mean, so it's well vetted, it's researched out. Patents don't get sent to your mailbox haphazardly. I mean, that is a long process that gets kicked down, comes back, kicks down. And so when something's patented, there's a safety profile, there's a reproducibility, there's efficacy. We could go on and on about that, and that's your area, Paul. And so when you look at these other knockoff versions, these silicone and even people that do filler with cannulas, I mean, I can't, Michelle, she's in the room across from me, but I cannot recall how many times we see someone who even gets a hyaluronic acid filler and they get 20 some odd units dumped at one time. and they've got girth, but I mean, their dick looks like a humpback whale. I mean, it's just there's nothing normal about it all. And then, you know, they're spending a lot of money for us to try to make these guys look normal. God forbid, and we see that with the cannula all the time. You can't control it. You know, using the patented technique with, you know, the way we do it with the needles, we control where we put the hyaluronic acid and how much we put where, and you may have a plan on that day for, say, the second or third stage, and you may change it seconds before you start or as you do it, because that's how the technique works. You can't control it if you're spraying hyaluronic acid all over the penis with a cannula. And God forbid you get into these, you know, permanent silicone or these pseudo silicone mixed with fillers, and that it produces your own collagen. I like how they started saying that. It's a disaster because it hardens up, it forms these little lumps and beads, and then trying to, you know, fill in around that or deglove the penis and pull silicone out. I don't understand anybody not using a patented procedure by a board certified urologist who probably knows the penis better than anybody else. I just don't get it. I don't know. Maybe it's just me. I don't get
Yeah.
it.
And then I guess that's will lead Paul to my questions because obviously we always talk about the importance of choosing a certified provider, someone who has dedicated their life to the anatomy of the penis and things like that. And we really beat a dead horse to death when it comes to that because of how truly important it is. But if you were to say to someone who might be hesitant or nervous about trying UroFill because of everything that's out there, what would you say to them, or what do you think might calm them when it comes to the UroFill procedure?
I'm going to try to make this as succinct as possible. Um, it's beyond the scope of this meeting tonight, but I patented my technique for the penile implant only so people that put in implants are people that have done extensive training so they won't hurt anybody. I was patenting this stuff before there was any financial gains or anything like that, only so those of us that know the penis, those of us that are stewards of the penis, are able to do this procedure. Because if you don't have some kind of way of policing people out there, and I'm going to call them the charlatans, you are going to have a terrible result, and your patients are going to suffer, and an industry that should be growing and helping people is going to get crushed. And so that's why we patented it. I did that. How many years ago was the original U.S. patent? Like 6 years ago. It is long before we started doing all this stuff, because it belongs in the hands of people that are going to do a good job on you.
Yeah.
So you need to do your research, because I don't know if you're getting to this question, but Clay, how many procedures have you seen in the last year that are suddenly coming out? And I'm not going to use their names because I don't want to give them any credence at all, But there's a new name and a new procedure that's not based on any data, not based on anything but what they're putting on the internet. And you, as a potential patient that might want penile girth enhancement, that is where you have to run as fast as you can. And I can tell you that all of our colleagues that are joining us, these are men and women that just care about the end result. And now, whether or not it's pathology or it's a vanity project. And I can't, and Alfie said we're beating a dead horse. We're beating a dead horse
Because no one's
amongst ourselves.
listening
And
amongst
so
themselves.
I don't know how many people are on tonight. This is our first one, but you tell everybody to get on the next one, and so that they don't go through the shit that we have seen for years. And that's going back to your first question to me, is what prompted me to do this. Is I saw the shit that was out there. It was not good, and I knew men were going to do something no matter what.
Yeah.
And we came up with something that, Clay, you and I have operated for 8 years together with implants, and we have a unbelievable track record. And you've been doing this now for 3 years with us with the UroFill technique. It's only a technique, but that technique belongs in the hands of only board certified urologists who have been trained by board certified urologists. And now we have several university complexes that have joined in. So now it'll start being taught at universities, right? So are you going to go get a colonoscopy by a plumber? Believe me, I love plumbers. I would love to be a plumber. My plumber is a badass and he makes a shit ton of money, right? And he has much better hours than me. You're going to go to, somebody that has accolades and years of experience and not just brief through some anatomical textbook.
And this leads me to you, Clay, Dr. Williams. As a board certified urologist, as a certified UroFill provider, I mean, how do you handle patients' expectations to ensure that they're realistic, satisfied? Like, when a guy comes in the first time, what's your thinking?
Well, that's kind of funny. So, this is a duo partnership with my wife, Michelle, and me, who run Elite Enhancement. To answer this, she gets all the phone calls and the emails and text messages way before I do, and she does a phenomenal job of talking and walking these guys through on text and phone about really diving into who they are, their age, what are their expectations, the cost of that, but trying to explain that, it's not a one-stop shop. You're not going to come in and get everything you want at one time. You've got to understand this is a staged procedure, which obviously I'm going to go in more detail about that the first time I lay eyes on them for the consultation and hopefully to proceed with the UroFill. But she does a phenomenal job of doing that. And it's kind of interesting in these men get a female answer and perspective of it, which might be, at least I think, maybe different than what I would say initially to these guys. I would think as a man, she comes across as a woman's perspective on on male girth enhancement, but with me as her husband with a urology background, and it's I ought to record some of our conversations. I was like, you should give lectures across the
Yeah.
country on marketing and but not being a salesman as much as you're answering the questions with vigor and excitement, but you're answering the questions when they come to see me. I'm basically kind of repeating things that she said, but now in more detail,
Gotcha.
not biochemistry, but explain more about the stage process and why we do a stage process, and but when they call, she goes through all the stuff about the knockoff things, about the dangers of getting too much filler at one time, and she's real quick to tell them about the silicone. Everything's on the internet, and all this is becoming more and more common, and guys are beginning to do a lot more research. And we have a lot of guys that will call us and say, hey, I called this place, I called that place, I actually went to this place, and these guys are not comfortable with these non-hyaluronic acid places or the knockoff fillers that are hyaluronic acid. Men are becoming very astute. They're doing their due diligence, like buying a new car or truck. They're not just jumping into it. They're really dissecting this out, and they're all being drawn to UroFill because they know it's the only way to go. And so she does a good job. And so I don't know if I really answered your question, but it's kind of a
Oh no,
go
you
between
did.
me and
Yeah.
her. you
We
know.
we
So
we
we do a
always
lot
we
of work
always
up front.
that's great. And we always do talk about Urofil being fully customizable. Because at the end of the day, we can give our recommendations, but the end user being the patient and their partner, it's what they want, essentially.
Yeah.
And that's what we try to get the message across. It's not about the biggest penis in the world. It's what's going to satisfy the patient and their partner. And that's what's truly important for us.
Yeah, a lot of these guys get hung up on a number. Hey, I want to come in, I want 4.5 inches. I want, 5 inch, I want six, and then we're like, well, a couple of things. Number one, that's going to take a while to stage it, and this is going to be a process. That's not going to happen today. It's not going to happen in a week from now. Um, but we're also really good about, okay, but don't get too hung up on the number alone. I mean, we've had people who, buy different size, vibrators and dildos, and they know this is what she wants, and that's the goal. But in the end, given the guy's his health, his age, some guys are not going to get to that girth. And if they do, it's going to take a long time. And so a lot of it is they get hung up on a number, but you may not get to that number. But what you give them is gorgeous, usable, and that they're happy. So again, it's giving realistic expectations, not to, so they don't get hung up on any one thing. It's the overall appearance and function is, I think what we're all shooting
Yep.
for.
Dr. Perito, you want to add anything to that? I mean, that's well
Now,
said.
that you're not. You'll have these centers that are showing you different sizes, circumference. We're looking for the best cosmetic end result and the best functional end result, which is what doctors do. Okay, and that combination might not be based on the tape, and we know it's not based on the tape. It's based on how it is delivered, because you can actually for at less expense get what appears to be a lot more and feels to your partner like a lot more in the hands of an expert. All right, you're not looking at just putting a tape measure around your penis. And I can't remember the last patient, and please vouch for me, Alfie, that has come in with a tape measure and said, I needed to be there and I'm here. They're coming in. And usually my favorite is when the partner comes in and the partner says, you know what? It's almost perfect. I want a little right there. And you're like, fuck yeah. I'm going to put a
Hell
little,
yeah.
I'm going to give you exactly what you want.
Yeah.
And watch that partner walk out with a smile on his or her face is just awesome. It's awesome. And that is something that can be done, using the UroFill technique.
You
So
know,
that's the thing I would add. Everything else is just perfect.
no, wow. This has been an incredible conversation tonight. I do want to give a huge thank you to Dr. Paul Perito and Dr. Clay Williams, for sharing their insights, these powerful messages of patient success stories, how we get there, how patients should do more research on their own volition before they even go anywhere. Go to a certified provider. Um, Before we end any of this, do you guys have any closing remarks?
Yeah, just one thing I want to say real quick. And again, it goes to why, using the UroFill technique, which is, only, board certified urologists that Paul elects to teach and train to his procedure. You think about facial and breast, plastic surgery. The breast cosmetically is sexual, both to the woman and to the man, or the partner. And then functionally, the breast has one job other than sexual interplay. It produces milk. It's a mammary gland for breastfeeding. That's its function. When a woman is pregnant and they're dropping milk down, the breast gets enlarged. Okay, it's a slow process, and when they're done, the breast usually reduces. But it doesn't increase and decrease all day long. If a woman gets a breast implant or a breast augmentation, they get a size. They go to a size, or maybe they downsize. But the penis is not the same. It's a dynamic organ, right? So again, cosmetically, I don't think it's the most pretty organ in the world, but that's me. But it is a sexual organ to look at. But functionally, it's different than the breast. Yes, you ejaculate, okay, it's emitting something, but the dynamics of a non-erect to erect penis. And so when you're going to augment this penis, you're placing hyaluronic acid to give girth. You can't just think what this looks like in a non-erect state. If you don't place it in the hyaluronic acid in the right place, you put too much, you don't know the anatomy, you're going to get a penis that looks abnormal in the non-erect versus the erect, or vice versa, or both. And so I think that's another thing that we don't always think about with the penis is it's a very dynamic organ. That's not the same thing as putting fillers or in the face on it. You smile a little bit, but there's not as much dynamics in the face as the penis. And I think that's an important take home that only a board certified urologist with UroFill would even begin to think and understand the dynamics of a penis. I just wanted to throw that out too.
Yeah. Dr. P, anything?
That anything. So we've done this for 15 years for penile implants. Whoever's watching this, with Meet the Penis, we are going to do this for another 15 years. And when I leave this realm, it'll be another 50 years where we educate the populace. All right. You need to go to somebody that is a high volume expert at whatever you're doing, whether it's a prostatectomy, a penile implant, a girth enhancement. And hey, great job, Alfie. Our first stab at this kind of stuff.
Yeah. No,
Um,
and
but it's not our first stab because we've done this for years and we've been number one in the fucking world for years for penile implants. And UroFill is going to be currently is number one in the world for a technique that is going to give you a reproducible result. That you're going to have a blast. And it is. I love it when our providers say, my life is so much easier. And you're hugging your patients all the time. It sucks to tell somebody they got prostate cancer. It sucks. It is awesome to have the partner come in and say, give me a little bit right there. That is awesome. And it's hopefully patients that enter into this realm, you'll have that same experience. I can almost guarantee it with our UroFill providers, because that is that is what we are striving to do, is keep it in the hands of experts. Okay.
now, if today's discussion resonated with any of you and you're considering UroFill, the most important thing is to go to a certified provider. Check out UroFill.com. You can check out Dr. Clay Williams at enhancedtexas.com. But check out our whole list of providers. Urologists all around the world. We've been doing this for a long time, and we truly want what's best for our patients. So once again, thank you all for tuning in. Special
Those
thanks to Dr.
people
Clay Williams in Texas and Dr. Perito here in Miami.
those people that have had questions, they can get back to Alfie and Clay and myself. We are welcome to have questions fired at us, because you'll see we can answer them. Okay.
Awesome. Well, thank you guys again, and we'll
Yeah.
see you on the next one.
Thanks.
Thanks,
That was fun.
guys.
Fun.
Take care.